Welcome to Making Change Radio. I'm your host, Catherine Reed, and joining me tonight is Ashley Reynolds Marshall, who is the chair of the Virginia Council on Women and the CEO of the YWCA of Central Virginia. Thank you so much for being here, Ashley.
It's a pleasure.
So we want to talk tonight about equity in healthcare and addressing the challenges that has for communities of color. And it was interesting to me because we are connected on LinkedIn. We're connected in a lot of ways. That I saw that you had done a podcast with the Virginia Rural Health Association about your contribution to a book. And you have done many things in your, anybody to me that's under 50 is very young. So I look at you and I'm like, this young woman has done so much in your professional career that being a contributor to this book should not have surprised me one tiny bit. But it's an interesting premise, this particular book. So tell us a little bit about the book, where people can pre-order it to, and how you came to contribute.
Absolutely. So it has really been a pleasure to be able to join a set of just dynamic academics from not only across the states, but actually across the world, because we have some individuals who are contributors who live in Canada and one in Scotland. And so it has been, and I say this, and I know it will sound funny, it has been a delight to learn about conspiracy theories in this opportunity. So the book focuses in on conspiracy theories in the COVID-19 era. It is open for pre-order through McFarland Press, and we are very excited. It should be in actual tangible form in the next month or so. But the idea of the book was really taking a deep exploration of the conspiracy theories that have surrounded us since we really started to learn about COVID-19 in late December, early January-ish. And those conspiratorial thoughts really have a range of ideas and premises and backgrounds. And my contribution to the text was looking at the conspiratorial thoughts and ideas that were making their way through Black and African American communities. And just as a point of reference, I will interchange those, but oftentimes I will say Black because, of course, there are individuals who live here in the States who are not African American. They are from our Caribbean islands. They are from the continent of Africa. But also we looked at some of the thoughts that, because of our global nature, really had a thread from individuals in Africa to African descent individuals in the UK and so on. So it was really fascinating to be able to take a step back as a researcher and say, where did these thoughts come from and do they have any roots somewhere?
And you're you bring up an important point that I want to highlight for a minute, and that is the use of the term Black versus African American, and the fact that the style guide now for all the major media outlets is capitalizing Black to indicate people.
Yes.
Because as you said, even in the United States, there are people who have come here from other countries who are Black, but not necessarily African American in the sense that we mean descended from Africans brought here 400 years ago. So, that's important. And that's just learning a new vocabulary and being sensitive, creating cultural competency around how we talk about issues that affect, again, communities of color, which is Black and brown people. But COVID-19 was something that came out of the blue and shouldn't have surprised us, because work has been done for years on the fact that a global pandemic would probably be the greatest threat to humankind. But here it is, and we seem unprepared for it. And in communities of color, there's a whole different history there, particularly in the United States, with how medical science has treated the Black community. And now we're talking about vaccines and who are going to get the vaccines first. And this brings up this whole specter that the larger community may not be aware of.
Absolutely. So one of the things that we certainly found within our research that was part and parcel of the idea of conspiracy theories and conspiratorial thoughts, specifically in Black and African American communities, is exactly what you just said. It's that medical history. And for this particular part of the book, you'll notice I say things like conspiratorial thoughts versus a conspiracy theory. So sometimes we know that the conspiracy theories that float around, it hasn't always been on the internet. Of course, they've been around since the beginning of time, but oftentimes they perhaps don't have a historical root. It just could be a feeling or an idea or a concern that someone has that bubbles up into this larger snowball effect. But what we find, especially in African American communities, is that there is this deep history of health inequity as well as health trauma that has colored some of the thoughts that we are finding in COVID-19 conspiratorial thoughts. So, for example, you may see that there are a lot of African Americans who are very concerned about the idea of vaccinations and perhaps who should get vaccinations first. While it might make sense for communities of color to receive vaccinations sooner than later, because we do know from the data, COVID-19 is disparately impacting communities of color, really ravaging through those communities. But there is this history of, especially for African Americans, being tested on in the United States that makes many of them wary that perhaps this is just another time where they're going to be a guinea pig. The most, I would say, infamous of those that many people are aware of would be the Tuskegee experiment. And during that experiment, the United States Public Health Service selected over 300 African American men who had already contracted syphilis. The majority of these men were sharecroppers, so they were definitely on lower socioeconomic status in the South. They also recruited a control group of African American men who did not have syphilis. And the reason why this particular issue ends up being infamous for African Americans is because until the 70s, and this experiment started well before then, but what the Public Health Service was doing was trying to find out what happens to individuals who contract syphilis in the long term, which meant that these individuals did not receive actually appropriate interventions to be able to resolve the issue. And that includes after the discovery that penicillin very cheaply and quite easily can help with individuals who have been infected with syphilis. And so it wasn't until an article came out in the early 70s that exposed this experiment that finally they shut it down and individuals got that penicillin shot that maybe cost $5 to find some relief. But individuals had died in the course of this experiment. Individuals had passed on syphilis to their family, passed it on to their children who were born. And so it ends up being this moment where African Americans, very rightly so, may wonder, are we simply expendable? Because that experiment said, yes, you are expendable because we have a treatment and we're not going to give it to you. We're just going to see how this goes. So when we think about COVID-19 and you think about experimental drugs, it can take some African Americans back to that trauma of saying, I don't know if I want to put myself in line for this because I know what has actually happened to individuals in my community through public health care. I know what has actually been seen. And that's also not even taking into consideration some other certain health inequities that we know have gone on, including sterilization and other testing. Another famous one that individuals may know is the use of Henrietta Lacks cells without her permission. No one asked anyone, did not compensate her, but the use of those has made amazing breakthroughs.
It's been miraculous.
American woman.
It was miraculous. Anybody who has not read The Immortal Life of Henrietta Lacks needs to read the book because it was an egregious, unethical use of her cells and yet it cured so many diseases. It was a breakthrough in medical science. But again, to your point, it casts aspersions on the ethics when it comes to the medical community dealing with African American communities. For those of you who are just joining us, this is Making Change Radio. I am your host, Catherine Reed, and we are talking with Ashley Reynolds Marshall, who is the chair of the Virginia Council on Women and CEO of the YWCA of Central Virginia. And we are talking about equity in healthcare and addressing some of the challenges in communities of color when it comes to trying to provide a more equitable healthcare and what that even means. So I know some of the work that you have also done has been around maternal and infant mortality, which also is off the charts in this country. We have the worst rates for a wealthy country of any in the world. But even within that, it disproportionately impacts communities of color.
Absolutely. So first of all, just a quick definition. So when we think about maternal mortality, what we're talking about are deaths that are due to complications from pregnancy or childbirth. And even though between 2000 and 2017, world maternal mortality declined by 38%, which means it declined from an average of 342 deaths annually to 211 deaths annually. The United States did not. The United States rates continued to rise. So here in the US, we have the highest maternal mortality rate in the developed world at more than 2 deaths per day if we average them out over an entire year. And something that really struck me is what this means with this increase is that a woman who was born in 1989 will have twice the likelihood of dying in childbirth compared to her own mother. But that's only if she lives in the United States. That doesn't apply if she lives in any other developed country. So here, roughly 700 to 900 women die from causes related to pregnancy and childbirth. And even if that mother survives, we see more than 50,000 women experiencing severe complications. And that, unfortunately, has a very disparate impact when we drill down and look at race. So what we know is that right now, as far as a September 2019 CDC study showed, maternal mortality rates are 4 to 5 times higher for non-Hispanic, Black, and American Indian or Alaska Native women than white women. The CDC also found that the highest pregnancy-related deaths were 3.3 times as high for Black women as white women, and 2.5 times higher for for American Indian and Alaskan Native women. So I think something else that's very interesting is we are seeing these higher maternal mortality rates specifically in 2 subsets of ethnic minorities. We are seeing them in African American and Black women, and we are seeing them in Alaskan Native and Indigenous women, very specifically. We do not see the same high rates in our Latinx or Asian communities.
And so what is this sort of a nexus of certain things like chronic diabetes, high blood pressure, that tends to disproportionately impact those communities, less access to healthcare, because healthcare is a problem in this country, which is why the ACA was developed to begin with, was to make healthcare more accessible to more Americans. That's under siege right now. And even in Virginia, trying to expand Medicaid, took years and years. And I just want to mention as a footnote, open enrollment is November 1st. So for those of you who are looking to enroll and to get health coverage, November 1st, you need to put that on your calendar. But what is the nexus? Where do these things come together to produce these numbers?
And I think that is actually the question that medical science is still searching for, because something that we know about the maternal health outcomes, specifically of African American women, is that they oddly aren't necessarily socioeconomically bound, nor are they necessarily bound in pre-existing conditions. We do know that Black women are 60% more likely to experience preeclampsia than white women. And they, of course, experience poor outcomes because of that condition. And for individuals who don't know, preeclampsia is a very serious hypertensive disorder that's defined as a new onset of high blood pressure after 20 weeks gestation. So that means that the woman did not have high blood pressure before she became pregnant. It's that new onset of high blood pressure after the 20-week period. And so we know that because of that, it is one of the leading causes of maternal mortality, but it is also considered a more preventable cause of maternal health. But something that I found really interesting when the Council on Women started digging into this to look at maybe some things that we could talk about to bring this information to light was, again, that while we normally would look at resolving some health inequalities using community-based programs, so for example, the Children's Health Insurance Program, also known as CHIP, was created to try and make sure that no child gets left behind, no matter their zip code, no matter their socioeconomic status. But something that was very interesting for this particular issue is that it happens to not be socioeconomically bound. So what really struck my interest when it came to African American maternal health concerns was the fact that superstar Beyonce and tennis star Serena Williams both had very serious complications during their pregnancies. And these are women who absolutely can have access to the best healthcare. They can have access to the best doctors. They can have private sections of hospitals that they need to make sure, the paparazzi isn't taking pictures of them while they're trying to give birth. It all makes sense. But especially the one that I thought was very interesting is Serena Williams, where she told them over and over again that something didn't feel right in her body. And it took her husband to say, no, really, check my wife. And they found out that there were some very serious issues, but she's a world-class athlete. If anybody knows what's going on in their body, typically athletes do. And this is backed up for those of us who are not Beyonce or Serena Williams. So we know that there is increased maternal mortality and maternal morbidity in Black women, no matter their income. So New York City's Department of Health and Mental Hygiene published a report that showed that Black college-educated mothers still fared worse than women of all races who had not completed high school. So these are women who clearly, because of their educational attainment, most likely have a higher income and access to health care as compared to a woman who did not complete high school, and they still fared worse. New York also found that Black women who lived in some of the wealthiest neighborhoods continue to have worse outcomes than white, Hispanic, and Asian mothers in the poorest neighborhoods. So oftentimes when we're talking about health disparities, you're absolutely right. We wonder about the access. Are they able to access care? Are they able to access quality hospital systems that aren't perhaps overtaxed and overburdened? And what this is saying is actually yes. Black mothers are able to access quality healthcare through quality doctors and hospitals and nurses with prenatal care as well and postnatal care, and they still fare worse.
And this is interesting because you would think that this would, that there would be research, that the NIH, that all these people would be going, we must solve this problem. For those of you who are just joining us, you're listening to Radio Fairfax. I'm your host, Catherine Reed, here on Making Change Radio, and we're talking with Ashley Reynolds Marshall, and we're talking about equity in healthcare and how we need to address the challenges facing communities of color. And so this is another question. If we know that this is an enormous problem and it's not socioeconomically driven, then why aren't major research institutions and medical schools, why aren't they funding studies to figure out what it is that's driving this?
And I think that is a fantastic question. So through the work of the Council on Women, the Northam administration actually took the summit that we held in Roanoke, Virginia in 2019 to a new level. So they held multiple summits across the Commonwealth to hear from women about their experiences and also to bring expert panels. And in full disclosure, some of the stories that were told, one of them that's been told at every session is mine, as to why I don't have children. And part of it is because no one has ever told me how I can stay safe. So no matter how many doctor's appointments I've been to, and I very thankfully have access to quality health care, and generally most of my life have, no one has ever actually said, Ashley, this is what we know, and this is how we can keep you safe. So I told that story myself. I got to tell my own story at the Lynchburg session. And Dr. Brian Ascent, who's an OBGYN at Johnson Health Center, which is one of our amazing federally funded health centers in the Commonwealth. He's an African-American OBGYN, and he took some of his time to pause, turn and look at me and say, I'm sorry, I can't keep you safe. But there has not been enough research done on African-American women for me to be able to actually tell you why this occurs with any level of certainty. He said, my pledge to you is if you ever decide to have a child, I will do my best to keep you safe, but I actually can't tell you why, and I'm very sorry for that. And the interesting part is that's the first time that anyone's ever actually just talked to me about it, was in that very moment. So what we know is just that there has simply not been enough research done on African-American women and their maternal health outcomes. We are seeing calls for that. Senator Kamala Harris, with our Senator Tim Kaine as a co-sponsor, proposed a bill in 2018 that would provide more funding for research. And Senator Kaine has proposed an additional bill that he did in July of this year, along with Senator Lisa Murkowski as a co-sponsor, that again does have a request for funding for more research and study of maternal health. But right now, it just doesn't exist. And oftentimes, though, we have some thoughts, but nothing concrete.
Well, it's interesting too when you say, budgets are simply a statement about priorities. You fund what you care about, you fund what you have said is important.
Mm-hmm.
But there's also a diversity issue at some of these institutions. There is a diversity issue around the table where people are deciding what is a priority in things like research.
Mm-hmm.
Clearly cancer is being researched. I mean, there's, everything needs to be solved. There's no
Mm-hmm.
unimportant health problem.
Mm-hmm.
But where is the representation around the table that says this needs to be lifted up? It's a critical issue.
Yeah, and we absolutely see that. So a study showed in 2014 that Black Americans only made up 4% of the nation's physicians. And so sometimes what we see is when there aren't individuals at the table where these issues impact them, you don't think of researching it. So as a PhD student, I'll be honest, I research what's interesting to me. I happen to be an African-American woman, so looking at diversity, equity, and inclusion is interesting to me. But I know that my colleagues have amazing research that doesn't necessarily take into consideration diversity, equity, inclusion, or disparate impact on race, because that's just not where they took that interesting puzzle, as my dissertation chair, Dr. Brian Cook, would call it. And there's nothing wrong with that, but it does really shine a very bright and bold light on the fact that who sits around tables matters, and who has the ability to engage in such research and secure funding for it, because all of this research would require lots of funding, matters. Because again, we look at what's pressing. So right now, people stopping and studying COVID absolutely makes sense, or we look at what's interesting to us.
And when you say Black Lives Matter, this is so encompassing. It's more than what people have seen in the streets this summer. For those of you who are just joining us, this is Making Change Radio here on Radio Fairfax, and I am talking with Ashley Reynolds Marshall about equity in healthcare. When we say Black Lives Matter, when we have seen people finally pay attention to the disparities, and yes, there's disparities in law enforcement, there's disparities in mass incarceration, there is disparities in housing, there's disparities in education, and certainly there are disparities in healthcare. Do you see a light at the end of the tunnel as far as getting people to focus, institutions to focus on why we need to raise these issues up?
Oh, absolutely. So I think that First of all, individuals who've been brave enough to have this discussion and make a focus on diversity, equity, and inclusion and the disparate impact that certain policies or procedures have on not only communities of color, but also our rural communities, those who are socioeconomically depressed, those who have limited English proficiency or identify as LGBTQIA, have all paved the way to what we're seeing right now. And one of the things that we certainly are seeing are hospital systems actually hiring chief diversity officers to make sure that they are focusing in on that and paying attention to that work. We are certainly also seeing local and state governments decide that now's the time to maybe make a declaration. So, of course, there are communities around the nation that at this point have declared racism a public health crisis. So we certainly have seen that. In our own state, in the Commonwealth of Virginia in 2019, Governor Northam announced that he wanted to eliminate the racial disparity in maternal mortality rate in Virginia by 2025. So we certainly have individuals who are seeking to work on that. In addition, here in the Commonwealth, we have, I believe, the nation's only chief diversity officer. And so that office is certainly working hand in hand with our Department of Health Services and Department of Social Services to really take a deep look at this. And I say to take a look at it, not to deter anyone from the action that's being taken, but because we don't know why this occurs, we have to study it first. So it's not delaying a resolution, it's actually trying to find out what the resolution might be.
And this is fascinating. And thank goodness we have a whole second half of this radio show so that we can dig deeper, because I want to hear more about what your work on the Virginia Council of Women actually means as far as impacting some of the things that happens in the governor's office, among his cabinet members, and the General Assembly, the legislature as well. You're an advisory council, and I think you're doing important work. And there may be people who weren't even aware that Virginia had a council on women. But I think the role that you play should also be raised up, because we aren't going to solve problems till we shine a light and help our own state government prioritize what matters. So please join us after the break. You're listening to Making Change Radio here on Radio Fairfax.
This is Radio Fairfax, a public access cable and internet station provided by Fairfax Public Access, a 501c3 organization in Fairfax County, Virginia.
Al Cooper, Brooks Williams, Al Stewart, Cheryl Wheeler, Barlow Guthrie, Chris. Contemporary singer-songwriter folk artists side by side with long-standing esoteric rock performers. That's what Eclectic Hours is. It's music for baby boomers, music where you gotta listen to the words. Eclectic Hours, Sunday mornings from 10 a.m. to noon. James Taylor, Kate Campbell, Joe Cocker, Livingston Taylor, Lucy.
Hi, we're the Goo Goo Dolls. We're fortunate that our daughters have what they need to grow and learn. But that isn't the case for nearly 13 million kids in the U.S. that struggle with hunger.
Childhood hunger is a heartbreaking reality that Feeding America is working to change. Each year, the Feeding America network of food banks rescues billions of pounds of good food that would have gone to waste and provides it to families and children in need.
You can help kids in need in your community by visiting feedingamerica.org.
Brought to you by Feeding America and the Ad Council.
America, your children have an amazing superpower. They can help save lives by not having play dates. That's right. By replacing get-togethers with virtual play dates and video chats, they can help slow the evil spread of germs. And if your superheroes do go outside, make sure they continue their superhero wing by staying 6 feet away from others to protect everyone in America land. Find out more at coronavirus.gov. A message from the CDC and the Ad Council.
I'm probably okay to have one more drink before I drive home. I'm probably okay. I open the window to stay alert. Probably okay. I just popped some gum in my mouth.
Step out of the car, please.
I probably made a mistake.
Probably okay isn't okay when it comes to drinking and driving. If you see a warning sign, stop and call a cab, a car, or a friend. Buzzed driving is drunk driving. A message brought to you by NHTSA and the Ad Council.
If doctors told us that we'd made a breakthrough on COVID-19, we would rejoice. We'd feel hope that we could live our lives again, get back to work, back to doing what we want. Well, masks are a ticket to that freedom. We can help protect others and save lives by covering our noses and mouths, which is how the virus mainly spreads. Until there's a vaccine, grab the breakthrough that's already here. When we're out, it's masks on. A message to help keep you safe.
Brought to you by the Ad Council.
Welcome back to Making Change Radio here on Radio Fairfax. I'm your host, Catherine Reed, and joining me tonight is Ashley Reynolds Marshall, who is the chair of the Virginia Council on Women and the CEO of the YWCA of Central Virginia. I really appreciate your time, Ashley, because I know you are one busy woman.
Well, it's a delight to be here anytime.
And you do things beyond your day job, too. I was interested in your work with the Junior League of Central Virginia, Lynchburg, Virginia, and the fact that so many people don't understand the work of the Junior League, the amazing work. You've been a board member on the Girl Scouts of Virginia Skyline, which interests me. You are clearly have devoted your off time, your day job, to looking at healthcare, public policy, which you have a master's degree in, and working with organizations that support women and girls. I mean, this seems to be what you decided to do with your life, and we are all the better for it here in the Commonwealth of Virginia. Talk a little bit about you. You're from rural Southwest Virginia. I'm from rural Southwest Virginia. It's a different place. Not everybody understands that Virginia is a very large Commonwealth, and it's very different when you go outside the area where you may have grown up or where you live now. So talk a little bit about your journey. I want people to understand, how you came to be where you are doing the work that you're doing.
Sure. So I have had the distinct honor of being raised by two amazing servant leaders. So what I do just feels natural to me because I was raised by helpers. So I'm from Roanoke, Virginia, which, by the way, in Central and Southwestern Virginia, we are the big city. Do not call it rural. People will be very upset. I know that for individuals in Fairfax, we're quaint, but for our side, we're big stuff. But I grew up, born and raised in Roanoke, Virginia. My dad, Earl Reynolds Jr., has been in local government and urban planning for all my life and still is. He currently is the assistant city manager for Danville, Virginia. And my mother, Avis Reynolds, is a surgical technologist with Carillion, and she's been with Carillion her entire career. But I saw both of them lead and serve in different ways, but always leading and serving. And I had just some fantastic family. I'm just super proud. I know that may sound weird to some people, but to be from the family that I got to grow up with and that I got to interact with. A story that I did not know until my father and I did the NPR StoryCorps program. And our StoryCorps, actually, part of it got played. And the story that got played was part that I didn't know till I was sitting in that little Airstream, looking at my dad across the table and being like, really? But my grandfather, Earl Reynolds Sr., was the barber in our historic Black district, which is called Henry Street in Roanoke. And my dad, of course, being the young lad, was the boot black. He was the shoe shine kid. And whenever Black artists used to come into town, of course, when my dad was a kid, my parents have both seen colored water fountains. And so they would come stay in the Black area. And the first thing my dad said that any artist would do is they would go to the record store to count how many records were there, because that's how they'd know how their sales were doing. And then if they were a man, they'd come to the barber shop. So one day after counting records, who came to the barber shop but James Brown? And he asked my dad, I know, right? And he asked my dad to shine his shoes. And my dad said, I was very confused because this man was impeccable from the top of his head to his already shined shoes. But he did as he was told. And at that point, James Brown gave my dad $5, which for that particular time was a fortune. And he said, Now you just have to decide what to do with it. And so that story has just sort of stuck with me, of just the richness of where I'm from, the richness of my family, the stories my grandfather got to share, because being the barber, you get to hear everything. And just, the family that I was able to grow up with. But they always encouraged me to just go for it, as all millennials got that experience of your family saying you can be whatever you want to be and do whatever you want to do. But I just had a really good village around me. And so I ended up at Hollins University, where I have my bachelor's degree from in psychology. And there, I think I learned how to lead as a woman. There's no one else at an all-women's college or university to do it, so you do it. And we got to do a lot and experience a lot. We got to engage with our professors because the university is small. I remember one day I was sick and a professor called me and said, "You missed class. Where are you?" And I said, "I have a fever." And they went, "Oh, I'm sorry. Do I need to bring you anything?" But it was that kind of moment where they knew I wasn't in class and called, thinking honestly, I never skipped a class. I was not that kid.
I think you're very brave, though, Ashley, because being from Roanoke and going to Hollins, I graduated from William Byrd High School, which is a Roanoke County high school.
Yes.
But I wanted to leave. So even though Hollins really wanted me to come, I'm like, I can't be here anymore. I went to Emerson College in Boston my freshman year. I'm like, Southwest Virginia, no, I can't stay here. And so I really admire the fact that you did, because Hollins is a fantastic university. I mean, I went to George Mason. Eventually, that's where my degree is from. But to have stayed, not a lot of people want to stay where they grew up, but you did. Yeah. And it was a great investment.
I enjoyed it. I will be honest, though, I had gotten into Marymount University, and I asked them to hold my application because I didn't think I was going to like Hollins. I had always been, my best friend all through growing up had always been a male. And I was like, all women, don't know how I feel about it. Well, I never left. But also what I will say for those who maybe have a college or university in their hometown that they would be interested in if it wasn't their hometown, there are some benefits. Number one, I never saw my parents. And number two, when my friends had cars, we could go do laundry at my parents' house and save money. So it was beneficial. And I really didn't feel like I was at home, because I never was at home, other than, again, taking advantage of free laundry and raiding the pantry with my friends.
And then you got your master's degree from Tech. I mean, and that's after going to William and Mary for law school. So you are a Virginia girl through and through. I am through and through. I mean, you've lived in different places in the state. You've gone to all of the major universities in the Commonwealth of Virginia. You've given your time, your talent to organizations, whether it's Junior League or the Girl Scouts. But the fact that you worked for United Way, and you worked for the mental health in the Roanoke Valley before you even took this job in Lynchburg. Your commitment to Virginia, I'm in awe. My hat is off to you. I always think that I'm kind of committed too, but not quite the way you are.
Well, we have good people. And we have wonderful opportunities. I mean, the opportunity to go to the College of William and Mary for School of Law was amazing. Oldest law school in the country. Don't let the UVA people tell you otherwise. But it was just a fantastic experience of being able to grow and learn and question, because that's what you're supposed to do in law school, and write, lots of writing. A lot of writing, and then to be able to become a Hokie and go to Virginia Tech. And our public administration program, there is a document that most public administration professionals will read called the Blacksburg Manifesto, which came from Virginia Tech. Just absolutely fantastic work. And again, getting to challenge and learn and think was wonderful. And they persuaded me to stay for a PhD. And so I'm stare at my dissertation every now and then. But it's just been wonderful. And my experience in Roanoke as a working individual, I think, was really formative as well, from the magistrate's office to being able to work with who is now their CEO, Abby Verdilio Hamilton at United Way. And I have to talk about Pat Waters Young, because that's where you had asked before sort of how I moved into health work. And it really was thanks to Pat Young. where she ended up leading our division, where I focused in at the United Way on housing and financial opportunity, and she focused in on health. But we were one unit because the social determinants of health say your health is more than just what the doctor says. Your health is your environment. Your health is, can you walk on the street at night? Your health is, are you getting appropriate mental health care services? And so we really worked hand in hand. And that's where I learned about the intersection of traditional, I call it traditional health equity, with the work that I was doing, and how not having a house, for example, that has a black mold infestation can not only deeply impact your physical health, but also because perhaps that is the only location you can afford, you're sort of stuck. And so your physical health will continue to deteriorate because you continue to breathe in very awful things. But also because you feel awful, all of us have had to go to work when we didn't feel well. And are you at your best? Are you productive? What if you work on a line? And we've all seen that I Love Lucy episode, right, where they end up having to shove the chocolates in their face because they mess up the line. But that can really happen, and people can really actually lose their jobs for holding up the line. And actually, of course, Lucy and Ethel did lose their jobs at the end for holding up the line and eating all the chocolates. But I had never thought about how a toothache could affect your job productivity until Pat and Abby really led me through that. And part of that was their work with Healthy Roanoke Valley. So
you have hit so many things here. Like you say something and you've hit like 15 things. And I want to talk about them all. For those of you who are just joining us, this is Making Change Radio here on Radio Fairfax. I'm your host, Catherine Reed. And we're talking with Ashley Reynolds Marshall, who is the CEO of the YWCA of Central Virginia, as well as the chair of the Virginia Council on Women. So I want to parse all the things you said and bring them back together. Social determinants of health. Not everybody understands what that is, but it's important for people to understand that the zip code you live in can clearly, the data shows, impact how long you will live, and for a lot of different kinds of reasons. The fact that communities of color, because of redlining and historical public policy that has put them in areas where they might be near landfills or electric transformer stations or other undesirable locations, impacts those social determinants of health. The fact that that we have people who make public policy, so my husband Tom sits on the board of Neighborhood Health up here, which is an FQHC, which is a federally qualified health center, getting dental care. And you just mentioned a toothache. And so getting the legislature to budget so that dental is covered by Medicaid, and people are like, oh, does that matter? It matters so much to give people dental care. So I just want you to bring all of these things home to help people understand that public policy is so instrumental in helping to uplift and solve some of these problems that we do not consider on a daily basis are impacting individuals, their families, their communities, our economy. It's all tied together.
Absolutely. So something that I wasn't aware of until my experience at United Way that I learned is that going to the dentist is, of course, more than just getting your teeth cleaned. There are times where with certain chronic diseases, your dentist can identify that may be going on. And type 2 diabetes is one of them for certain things that they are able and trained to see. So when we think about individuals who maybe are on a low income, they probably are not seeing a doctor regularly. And if you think about a lot of the chronic diseases, what's one of the hallmarks of nearly every chronic disease? You feel tired. But if you're on a low income, you may be working a very physically taxing job. Everything from our childcare workers who are running around after our littles to restaurant workers that are on their feet all day. So you may just chalk up a sign of a chronic disease to just work or day-to-day life. But that dentist actually could be the person to help diagnose some of those. So having access to quality dental care is important, not only because all of us have had a toothache and it's awful and it hurts and you aren't very productive or nice, but also because that might be an additional opportunity for other diseases or other ailments to be uncovered, to then prompt the person to be able to go get additional treatment that could be everything from just making them feel better to saving their life, depending on what is found.
And so I'm going to bring up two other things that you've done in case people are like, what? She hadn't done enough already? You went through the Sorensen Institute, which back in 2013, I think, which is a leadership institute through the University of Virginia. You also went through Emerge Virginia candidate training program, I think in 2014, because you do understand that it takes public policy, which is put forward by elected representatives. And that is on the state level, not just the people that we put in the White House or in the Congress, but the people who decide to raise these issues up and go to Richmond to fight for public policy that creates better health care and better health equity for everybody in the Commonwealth. And it took years to get Medicaid expansion passed in this Commonwealth. It's taken a long time to get dental. Just to your point, I mean, people were not thinking that this is such a critical part of healthcare, and so many people just do not get any dental care at all. So, by going through Sorensen and also going through Emerge, clearly you understand that you're exploring lots of different ways in order to affect change for all Virginians. So,
Absolutely.
Tell us a little bit about your thinking there.
Sure. So I am just very honored for my experience being the political leaders program in Sorensen. I had some fantastic individuals who went through that program with me, and we still talk to this day. Some have moved away, some are still here, some are in local government. Andre McCullen in Norfolk, she was in my class, and both of us went straight from, I think we were rooming that day, where we literally both applied for Emerge. And so we both went at the same time from Sorensen to Emerge. And Emerge, I think, just gave a different lens. So for individuals who don't know, in the Sorensen Institute through the University of Virginia, the Political Leaders Program is really looking at the impacts of public policy and government on individuals in the Commonwealth. So you have the opportunity to travel around to different areas and sort of see where their needs are and what may be going on, talk to their legislators, and think through problems. Emerge is more of a candidate training. So it gives you kind of the nuts and bolts of how to be able to run for office if you so choose, whether that's local, state, or federal. And so I thought that they were just a wonderful pairing, because it's really enlightening to learn about how hard it is to run for an office. Even harder if you're a woman to run for office very often, but also knowing how the public policy can just impact change. So one of the things that I thought that was interesting that may just give an idea as to issues that could come up when we think about public policy is, I know that you all are in Fairfax. One of your big issues is transportation and traffic, right? Roanoke? Not so much. So when our legislature would spend a ton of time talking about Northern Virginia and Tidewater traffic, and not a lot of time talking about the coal plants that were closing in far southwest Virginia, or other issues with things like 81, which kind of always takes a back seat. But if you've ever driven 81, you don't want it to take a back seat. That was a really interesting moment that we had our first Sorensen session, where all of the Central and Southwestern Virginia participants were in this one block. And the first thing we actually said is, you can't put us in one block, because my friend who was from Big Stone Gap has very different issues than I had in Roanoke and another colleague had in Blacksburg. And to think that just this whole other side of the state all needs the same thing, it just isn't accurate. So we know that public policy can both help and hinder, that voices can be heard and silenced at the same time. And I do think that what impacts us day to day is local. What impacts you is the traffic light that annoys you, the pothole that breaks your car. And so I've always been very interested in the work that city managers and town managers do to make people's day a little better, a little brighter through city government, and then also what our state government does, because again, that can make your day a little brighter or a little more complicated.
And again, this circles right back around to your work on the Virginia Council of Women. So for those of you who are just joining us, this is Making Change Radio here on Radio Fairfax. I'm your host, Catherine Reed, and we are talking with Ashley Reynolds Marshall, who is the chair of the Virginia Council on Women, and CEO of the YWCA of Central Virginia. So let's talk a little bit about how citizens get involved if you're not elected to office. That is not the only way that Virginians across the Commonwealth can engage in solving problems like equity in healthcare. So talk a little bit about some of those opportunities and how people can look for them or understand how to engage on their local level and certainly, though, on the state level.
Absolutely. So taking the state level first, because that is actually a quicker conversation. Go to city council meetings, go to county administrator meetings, or you can usually watch them streaming or on your public access station. And that will give you a lot of insight as to what's going on. And if you have the opportunity, anyone can speak. You simply go early enough and put your name on a list, and you can talk about anything that you've seen or maybe haven't seen. That counts for school boards as well. So that is another way, again, where when you have that issue where you don't think it's getting resolved, you do have an opportunity to go speak with individuals who maybe can make it a little better for you. And what I often find is that those individuals may engage you later on. They may have questions and just be open to that. On our state level, there are hundreds of councils and boards where they are looking for citizens to serve. Some boards are a little more specific. So for example, the cosmetology board, they may be looking for someone who is a licensed barber or a licensed hairstylist. But that also gives an opportunity for that barber or hairstylist who maybe is from, Narrows, to be able to engage in the process of their own licensure. It's pretty easy. You just go on the Secretary of the Commonwealth's website. You can look at a list that will show you where there are vacancies and you apply. Now, of course, depending on the board, some boards have a lot of people who apply. For example, to be a trustee in some of our colleges and universities, they usually have a lot of people. There are some boards that maybe don't have as many because they are so specialized. But that's what I did. And actually it was through Emerge that it was encouraged that we look at that. And through my work in nonprofits, oftentimes we can't run for office. I am able to advocate for public policy, but of course I don't lobby at all. But this gave me an opportunity to apply for some boards that I thought could be helpful. And I happened to be selected to join the Virginia Council on Women. And the Council on Women is a statutorily established advisory committee or council in the executive branch. And our goal is to identify ways where women can reach their full potential and make their full contribution to society and the Commonwealth. So the council is made up of 18 members from around the state, and you are appointed by the governor. So I've been appointed both by our former governor, Terry McAuliffe, and I got appointed for a second term on the council by Governor Ralph Northam. And we are able to meet together and really try our best to give a voice to certain spaces. One of the things that we have been charged with from a previous administration is our STEM work. And so the council actually holds a STEM essay contest annually. If you go to our website, you'll be able to find it. It should launch in the next few months. So if you have a high school senior who is female identifying that wants to go into STEM, either through community college, through a four-year college, through a coding boot camp, we would love to have them apply for a scholarship to try and help them move the ball forward in their education, wherever that may be. But we also have had a healthcare focus in the past and also a community engagement focus. And that's really where some of the work that I've been able to do in maternal health comes from, a combination of the work that our healthcare committee has been doing, as well as the work of the YWCA, where our mission is to eliminate racism and empower women. So maternal health, especially African American and Indigenous maternal health, is really at that intersection of how do we empower a woman to have the best birth experience that she possibly can, but also we know that there's disparate impacts on race.
So I want to talk to, we've just got a few minutes left, but your work on equity, diversity, and inclusion, which I know you're doing with the Junior League right now, a lot of corporate entities, government entities, almost every organization after this summer of unrest and turmoil is saying, what can we do? And recognizing that they're not diverse, that there is not enough diversity of lived experience, perspective, thought, sitting around any table in any organization anywhere. But the problem that a lot of these organizations are encountering is, where do we find people? Because there is a pipeline problem that to me goes back to middle school. You talk about STEM. If girls aren't taking algebra in middle school, they're not taking calculus in high school, they're not taking higher math in college, they're not going to be engineers, they're just not. So where are the women engineers? We didn't look in middle school to say, why aren't they taking algebra? So among diverse communities of color, I don't think people are recognizing that we have to go way far back to figure out how to open the doors much earlier in the pipeline. Let this be your closing advice to everyone who's listening about how they can play a role in that.
Sure. So I think when we think about diversity, equity, and inclusion, one of the most important things that I've noticed, and this is also just my personal experience through my own career, is that you're absolutely right. It didn't necessarily go back far enough, but also there are some other considerations to take into place. So for example, are you publishing a salary in your job descriptions? Because there are individuals that unfortunately need to make a certain amount to pay back their student loans that got them the education where you want to hire them. How are we thinking about equity in terms of when we think of women? Are we providing equitable opportunities to work at home if they are a caregiver, whether it is of their child, a foster child, or a parent, or an adult child? How are we thinking about the education pipeline? Does someone need to have 10 years of experience to be in this role? Or do they need to have a bachelor's degree if they have done something extremely technical in a hands-on career? That is something I know my husband battles with. He's done a technical career, but he doesn't have a bachelor's, and there's some limitations to what he can do, even though he's far smarter than the average Barry, smarter than I am. But I think that would be one of the goals that I would suggest for people to consider, is just to think more holistically about diversity, equity, and inclusion. It's not just numbers, because also if you increase the level of diversity, whether that's individuals who are differently abled or African American individuals, what then? Are they fostered? Are they supported? Will they be able to move forward in their career with you? Or did you just check a box and now you have diverse people, so you're done? And I'm going to tell you, you're not done.
And that is the best thought ever in looking at how we can all play a role in equity, not only in healthcare, but equity everywhere. Thank you so much, Ashley. This has been a privilege and an honor. And for those of you who are listening at home, Making Change Radio is on the air on Radio Fairfax every Thursday at 9 p.m.